and welcome to Health Live at Seniors Today. It's a very bright and cheerful evening here where I am, and this is being recorded on on the second last day of the financial year. So we wish you a very happy, fiscal year ahead. I am particularly delighted to introduce to you Dr. Akhilesh Yadav, who is Associate Director Orthopedics and Joint Replacement at Max Super Speciality Hospital in Vaishali. Vaishali, as you know, is part of the New Delhi NCR region. And other than the Max Hospital, he also practices in various other hospitals. He has been director, as I mentioned, of orthopedics at the Healing Tree Hospital in Ghaziabad, in addition, joint replacement and arthroscopic surgeon at Pushpanjali Crossley Hospital in Vaishali, clinical associate, Department of Orthopedics at the Fortis Hospital in Noida. Fellowship, he's done a fellowship in joint replacement from Germany and from New York, and also from Leelavati Hospital in Mumbai. He's an MCH in orthopedics from the University of Dundee in the UK. He's also done his MS in orthopedics from MLB Medical College in Jhansi and an MBBS from BRD Medical College in Gorakhpur. He's a life member of the Indian Orthopedic Association. He's a life member of the Indian Arthroscopy Society and a life member of the Indian Arthroplasty Association. As I mentioned, he's a specialist in joint replacement and arthroscopy. And today we have invited Dr. Akhilesh Yadav to speak about osteoporosis. Osteoporosis for seniors is the topic that we have for Dr. Yadav, and he is kindly consented to be here. He is joining us, from Azamgarh in UP, and this is, I think, our first time that we are having somebody taking a session from the hinterland, if I might say, but hinterland which is progressing. And so, welcome to Health Live at Seniors Today.
Yeah, thank you so much, sir. Thank you so much for this invitation. And I'm really very happy and delighted to be here on this platform. And I would like to share my experience about the osteoporosis to our beloved senior citizens. And thank you so much for this invitation.
Thank you very much. So before I invite you to speak, as always, Dr. Yadav is not going to be making a presentation, but he's going to speak to us for the next 10-15 minutes. And those of you who have questions, please listen to him first. And then after he finishes, you can put down your questions in the Q&A tab. As always, mention your gender and your age, and that will help Dr. Yadav give a considered reply. Over to you, Doctor.
Okay, thank you so much, sir. And thank you so much, our beloved senior citizens. And I'm here to speak you about the osteoporosis. We should understand what is the osteoporosis first. And I'm sorry, I'm in a remote area in UP, and because I came here for an occasion at my maternal place, so for poor connectivity, maybe in between, some glitch may be there, but I would try to recover everything. Okay, so osteoporosis. Osteo means bone, and porosis means pores. So when the bone comes in porous condition, that is called as osteoporosis. And you know that this osteoporosis usually affect the adults, and I can say at the age, if you can say more than 30 years, and in India, it's mostly involved the elderly person. And in 2021, the census says the Indian population more than 60 years of age is around 8.6%. If we can see the prevalence of this disease, so one of every 2% may have osteopenia, not porosis. Okay, osteopenia means just the beginning of the weakening of the bones. And second terms, I told you that osteoporosis. Osteoporosis affecting one out of 5 people in India. And if we go for the gender wise, so no doubt females are more commonly involved than males, and post-menopause, when the periods, ends, and after that, around one out of three females have the osteoporosis. So we can see the prevalence, the burden of the disease in the society. Okay, so how it occurs, how it happens. So this is aging and nutritional problem. When we are aging, definitely the bones loses very quickly. And up to the age of 30, the balance of losing and building, uh, usually equal. But after 30, the catabolic process means the degradation of the bone getting over to the formation of the bones. So initially it becomes osteopenia, and when we are not aware about it and we are not taking care of this at this stage, it may convert into the osteoporosis. Okay, so what is the symptoms? If we ask about the symptoms, so symptoms are pain. The most common complaint is pain in the bones. Okay, and second thing, the pain in the muscles also. And the more disastrous thing is the spontaneous fracture without any injury. And you know that if a patient or person is going, slowly and having a little hurt, and they may develop fractures. And most common areas of the fractures are the spine, the hip, the wrist, and uh, occasionally the pelvis. So these are the symptoms, okay? And patient may feel tired, weakness, laziness, very easily and quickly. So these are the symptoms. How we can diagnose it? So it's very simple. Go to a good orthopedic consultant. He or she may examine you, ask the history, and if required, uh, she or he may prescribe some tests. So what are the tests? So simple. The best test is the DEXA scan. Although, in society, you may saw already that camps are there. The hospital used to organize the camps, and they are carrying the BMD machine. So BMD machine is a preliminary test. You can say it would give an idea about your bone, but not the staging of the osteoporosis or the quantitative uh, results of the osteoporosis. So best is DEXA scan. If you are having constant, continuous nagging back pain and without any radiation of the pain, so you may have osteoporosis. So X-ray is also a very early tool. X-ray can be used, but as I told you, the DEXA scan is the best. Now, the second things are the blood tests like calcium level, vitamin D level, vitamin B12 level, vitamin C level, vitamin K level, and the serum calcium level. Alkaline phosphatase can be used, or the more advanced tests are the PTH, hormonal tests. So I think the preliminary test, the X-ray, DEXA, and the vitamin level and the calcium level would be sufficient for diagnosing the osteoporosis. Now, if a patient is not having osteoporosis or osteopenia, so how can we avoid this condition? Number one, very important. Number one, control your weight, do activities, be active, do regular exercise or yoga, whatever you like, and your nutritional level should be good. Means you should take a good amount of calcium, vitamin D, vitamin B12, vitamin C, vitamin K, and proteins. So these are the nutritional things. So if you are taking these nutritional things and doing regular exercises, you can avoid being a patient of osteoporosis or the osteopenia. Suppose if a patient is having osteoporosis, then what? So no doubt there are lots of options of the treatment. So initially, simple way is the tablet, or you can say giving a supplement and uh, getting some exercises. So these are the initial option number one. Option number two, we can give some anti-catabolic uh, drugs, means medication. Medication would be the best word, not the drugs. Okay. So medications, as I told you, that anti-catabolic means the medications which avoid the bone loss. So these are some medications like osteophos, bisphosphonate. We categorize and a group like bisphosphonate, alendronate, and there are three, four medications. So these are on the basis of weekly or twice weekly. So this is simple. Now, if sorry, one thing left. The DEXA scan, मोटा मोटा मैं आपको बता देता हूँ. So there are grading, means there are WHO, World Health Organization described the categories of the osteopenia, normal bone, and osteoporosis. So roughly you can say if anyone is having T score less than minus 2.5, so definitely osteoporosis. If it is between minus 0.1 to 2.5, so this is osteopenia. And if it is more than minus 1, so it is normal. So these are the things. So you should learn that if the reading is less than minus 2.5, then it is osteoporosis. Okay. So as I told you that if it is osteopenia, we can treat it well with the change of activities and some supplement. When but when we are going to be osteoporotic, then definitely we should be serious. We should take precautions in our activity, jumping, running. We should avoid actually, and the medication. So there are some injectable medications, injections. So there are some medications, some injections are on 6 monthly basis. Some injections are on yearly basis. So these injections are to avoid bone loss. One injection is there which use for the bone formation, and that is given on the daily basis. It's just like an insulin pen. You can use, you can, fix the dose and inject with a click beneath the skin, over the stomach or over the arm, right? And most of the patients, uh, I can say, they are really reluctant about this. And when they get fracture, so then they used to be diagnosed with the osteoporosis. In that case, you know that surgery used to be the only option. And if the fracture in the spine and it is severe, so operation. Otherwise, sometimes we can manage with the conservative things like without operation. But if a patient or person get fracture in the hip, definitely surgery. We can't avoid it. So sometimes we have to go for the hip replacement. And one more thing, if a patient is of osteoporosis, having osteoarthritis, means two conditions with this, at the same time. In that case, if the patient is having osteoarthritis in the knee and osteoporosis also, so we have to go for the knee replacement. And in that case, this is rough idea for you people that we have some special implants to be used. Otherwise, your replacement may fail in the future. So what are the implants? We used to, use the stem, the tibia side, I mean from the leg, on the leg side or on the femur side, means upside. So these are the things I wanted to share with you all, respected seniors. So that's all from my side, and I would love to answer your questions.
Thank you very much. Thank you very much, Dr. Yadav, for speaking to us. I have a few questions that have come in. One is from Mr. Bharat Mehta, who's 67. His
Mhm.
question is um, how to keep knees, femur, or senior citizens strong, and which exercise or medicine is best for solving bone problem in the future.
Oh, great question. This is, all in one. Okay, so to avoid, first I will take the osteoarthritis. Okay, so to avoid osteoarthritis, if you are in suppose 50 years or 60 years or 55 years, you should avoid activities like jumping and cross leg sitting, squatting. You should avoid if you are having some kind of osteoarthritis, okay, in the knees. Uh, and there are some supplements that can be used, like if anybody, a normal person is taking vitamin D, vitamin B12, calcium. So you can also take it. And some glucosamine, chondroitin sulfate, collagen peptide. These are the supplements which can boost your cartilage to avoid osteoarthritis in the knee. And for the bones, as I told you, that exercise, light exercise, yoga, and the supplement of the vitamin B12, K, D, C, E, A. So these are the important things to be remembered to avoid the osteoporosis and osteoarthritis.
Right. Thank you. We have a question from Shamla Ravi, and you mentioned about glucosamine. She asks, is glucosamine and chondroitin sulfate useful as prophylaxis to prevent osteopenia or osteoporosis?
Okay. So glucosamine and chondroitin sulfate, they are best for avoiding the osteoarthritis, not the osteoporosis. So these are the supplements meant for osteoarthritis. And
Right.
one more thing I want to add. So these medications, we call as oral supplement for the osteoarthritis, they used to work, they have their effect in only two-thirds of patients. One-third patient may not have such, demanding results. In that case, there are other options like putting injection into the knee, like taking oral, I mean, apart from the chondroitin sulfate and the glucosamine.
Right. Thank you, Doctor. There's one question that has come in, which is, Doctor, you mentioned about no squatting and similar exercises. But in yoga, quite a few exercises require you to sit cross-legged, and there is some
Yeah.
amount of strain to the knees. What is your advice on that?
Okay, so I'm also a yoga person. I usually do daily yoga in the morning 6 to 7. Okay, so I know the positions in which pain may occurs. So avoid that position like Vajrasan, like butterfly asana, like the jumping jack they used to call. So we have to avoid these kind of activities. Otherwise, if you are sitting on the floor, lying on the floor, or if you are doing yoga on the hard surface like any hard bed or something, that's fine.
Right. In fact, this is the next question is also on that. Does osteoarthritis aggravate due to jogging and exercise which entail bending of knees and squatting? You
Okay.
mentioned frequent squatting. So,
Uh, So if you are having, means a patient is having osteoarthritis, and if suppose it is grade 2, grade 3, definitely it may aggravate on doing these kind of activities like squatting, sitting cross-legged on the floor, and using the leg press in the gym, and using steppers in the gym. So these activities should be avoided. Number two, the exercises, I would tell you the in the gym. the exercises to be done for the osteoarthritic person is cycling, leg extensions. These are two most important things for the osteoarthritic patient to do.
Right. Thank you. This is a question from Mini Gogia who asks, what are osteophytes?
Oh, great. So osteophytes are the outgrowth of the bone. Okay. लोग कहते हैं कि हड्डी बढ़ जाती है. Like, so, there is a formula in the physics. Physics formula is F pressure is equal to force by area. Okay. So when the force is increasing and area is little, pressure would be more. Am I right, sir?
Right.
Okay. So when the force means pressure, the body weight is increasing and area is little. So body thinks we should expand the area. Okay. But you know that when it increases the bone area, the false bone is forming. And that false bone is osteophyte.
Right. We have a question from Mr. Anil Sahni who asks, are cramps in any way related to osteoporosis?
Of course, of course. Cramps in the muscles may be a sign of osteoporosis. And that may be because of deficiency. Vitamin D, vitamin B12, vitamin E, vitamin A, calcium.
Right. We have another question from Sangappa Koti who asks, is ankle weight exercise helpful in strengthening osteoarthritic knees?
A non-weight bearing strengthening exercise, I would say. Okay. Means if you are putting weight on your shoulder and doing squatting up and down, this is not good. If you are putting a weight on the ankle side and taking your leg up and down, this is good for the muscle strengthening and it would help you in osteoarthritis.
Right. Doctor, we have a question from someone who asks, my wife has been advised to take a injection which is Denosumab 120 for every 3 months because of calcium levels. Is that something that is advisable for somebody who has been through some calcium deficiency issues?
Yeah. It means the patient, his wife is having osteopenia to osteoporosis. And as I mentioned in the treatment part, there are some injection which can be given 6 monthly, 3 monthly, one yearly. So Denosumab is the one we can give on the 3 or 6 monthly basis to avoid bone loss.
To avoid bone loss. We have a question from an anonymous attendee who says, my mother, who's 86, has had a hip joint fracture which got infected. Doctor said hip joint replacement is not possible in the case of infection. Request for your opinion.
Okay, doctor is right. If any part of the body is having infection, suppose this is the hip case, and if the patient is having hip fracture and having infection in the urine or having infection in the skin, so in these scenarios, we can't go for the hip replacement because after the hip replacement, the chances of infection or in that replacement thing would be quite much higher.
All right. Doctor, we have another question that has come in, which says that how does osteoporosis management change for seniors who have health conditions or taking multiple medications?
Okay, if the patient is having multiple medications, so we have options like, as I told you, the oral, apart from the oral medication, we can go for the injection. Simple.
Right. Absolutely. We have a couple of questions that have come in from people.
I'm enjoying it. I'm enjoying it actually.
Doctor, there's a question which is interesting. If I do have pain in the knees, but I also know that I need to walk extensively, how do I manage to do both, which is overcome the pain in the knee and hence not strain the knee and yet continue my walking?
Okay, good question. And the answer is, if you want to walk and you are having pain in the knee, so first you have to get rid of this pain. How? To number one, to take some medications to strengthen your cartilage and strengthen your muscle with the exercise. And I think if your pain is uh, in grade 2 or grade 3, after 1 month of medication or physiotherapy exercise, you would be able to walk, no doubt.
Right. There's another question that has come in. Is massage all right for people who have osteoporosis?
I would not suggest. Okay. Reason I'll tell you. I have seen many cases. A patient is of osteoporosis. Suppose he doesn't know that he is having osteoporosis. And with the massager, I mean, a person, lamba tagda, and doing massage, and he made fracture in the hip. I have seen that. In the shoulder, I have seen the wrist, and most in the ankle. So I would not advise for the massage.
Right. Thank you. We have a question from Archana Gupta, who says, I'm suffering from plantar fasciitis. What are the treatment and precautions I have to take?
Okay, so I would tell you the whole treatment about the plantar fasciitis. Plantar fasciitis is a condition having inflammation in the heel. Okay, heel means where the fascia of the sole attaches at the calcaneum. Heel, you can say. So there is a inflammation, and more than 90% cases having no diagnosis, I mean no cause, idiopathic, and only 8 to 10% cases having causes like increase in uric acid, like rheumatoid arthritis, having flat feet, and job of prolonged standing, long walking on the hard surface. So these are, and changing of the shoe, footwear. So these are the causes which accounts for 8 to 10%. If these are the causes, we have to treat it. Suppose there is nothing, no cause, idiopathic. So precautions are, you have to avoid barefoot walk. No barefoot walking. Number two, you have to use soft footwear. Number three, you can use silicone heel into the shoes, whatever you are wearing. Number four, you have to do Tadasana. Tadasana, tiptoe exercise. So these are the good things to do.
Right. Thank you. You've been very precise in your response. Thank you very much. We have one last question which has come in, which is, I have some pain in the sole of one leg. What could be the reason and what is the possible treatment?
So as I told you that there is this condition is also known as plantar fasciitis, sole pain.
Right.
It may be because of inflammation, or second cause, it may be because of the weakening of the small muscle of the foot. So
Right.
we have to look into the cause, and then accordingly we can treat it.
Right. Thank you very much, Dr. Yadav, for being here. I know you are at a family function, and all the best to your uncle who's retiring today in Azamgarh. And thank you very much. Thank you very much to the Max Hospital in Vaishali for facilitating this. We will be back once again, as always, on a Saturday evening at 5 p.m. for our next session of health webinar, Health Live at Seniors Today. As always, those of you who want to pre-register, or if you want somebody else in your family and friends to pre-register, the form is there in the chat. The Seniors Today magazine of the last issue is still available online, and you not only have this issue but all the 57 issues that have been published so far. You can access them. The last issue, as you know, had even if I might say, call it a scoop interview with Mrs. Tina Ambani, and some very interesting articles, even if I'm saying it myself. And so do check it out. It's available online on the Seniors Today website, and it's available free of cost. once again, as I keep mentioning, the Evergreen Club app is available online on Android as well as iOS devices. You can access that. We have a host of new events that are starting from April 1st. So, and this is no joke. So please do join for them and join the Evergreen Club. Next Sunday, that is April 7th, we have the finale of season 14 of Seniors Have Talent. So do join for that. That is at 11 a.m. on Sunday, the 7th of April. So join in if you can, and it will be a lot of fun. And we will be back, as I mentioned again, next Saturday at 5 p.m. Thank you once again, Dr. Yadav, for being here. Thank you very much.
Yeah, I want to say something.
Yes, please go ahead.
It was really very good experience and interesting things, because I was enjoying the answering questions, right? And Mumbai is very near to my heart, because I used to come to Mumbai. Sonu Sood is my friend, and I'm treating Neha Kakkar family, Kangana Ranawat's family, Aswat Bhatt, Rajpal Bhai. So these all are my patient and friends too. So
Right.
I would definitely come to meet you.
The good thing is, of course, we in the Seniors Today family, and which is why we request that we do it in English, is because we have a host of people who are from all parts of the country. But we must, with doctors like yourself, we must attempt doing a few sessions in Hindi as well, and which will, involve people from across the regions who are more comfortable with the language. So we will also do that, and we will
definitely
engage you at that time. Thank you very much once again, Dr. Akhilesh Yadav, for being here. And
thank you, sir.
All of you here, we will be back once again next Saturday. That is April 6th at 5 p.m. Thank you.
Thank you so much. And I would love to come again with the osteoarthritis topic, which there are lots of questions on that also.
Right.
Thank you so much.
Thank you.
Subscribe now and press the bell icon. Never miss an update.